Hello, my name is Mohammad Javed, but today I am going to start the topic about women cardiovascular health in Pakistan, challenges and solutions to closing the gender gap. We are five members in our group: Abdul Rafay, me, Muhammad Javed Bhatt, Muhammad RIAZ, Karanbir Singh, and Ali HUSNAIN. This is my introduction, which I am going to elaborate. Cardiovascular disease is the leading cause of death globally, yet significant disparities exist in how it affects men and women. In Pakistan, these disparities are particularly pronounced, with women often receiving less attention. Heart-related issues, let's see. There are different risk factors for this disease. Risk factors are like diabetes, stress, pregnancy and complications, smoking, and menopause. There are different things. Take heart disease seriously and pay close attention to CVD risk factors. Would Heart Federation. Now I'm going to describe the different kinds of the things of about this. One is for middle-aged adults in Pakistan has prevalent CVD. Young women are at more risks. Women unable to recognize and delaying medical help. Late presentation at hospital result is a poorer outcome of this disease. Lack of awareness and the shortage of women heart specialists. These kinds of the CVDs in Pakistan. Gender, and the other thing is a gender disparity. The gender disparity, there are different kinds of factors which causes the risk of these things. Unique risk factors of women on onset of menopause, diabetes and pregnancy. Though low incidence is seen in female, but CVD is fatal for women. False assumption of low risk for a woman is an other thing. So the prevalence of no obstruction coronary artery disease in a field higher in women still receive no guideline and delay diagnosis. This is the main factor, I think. Lack of healthy diet because of social terms and economic contains in Pakistan increase burden CVD on women. Women don't always recognize their symptoms as those of heart disease, of generally delay seeking medical help due to culture barriers that uh, restrict women access to health care, to the hospitals facilities. They tend to late in hospitals, thereby increasing their chances of subsequent heart failure and mortality. There are the different objects which are of this disease. This presentation aims to explore the current of state of cardiovascular health, I mean CVD, among women in Pakistan, identify the factors contributing to the gender gap and propose actionable strategies to close this gap. This instituting healthcare professionally and policymakers develop the formulate strategies culturally sensitive for prevention, treatment, and the education of CVD. The significance are the addressing the gap is not only the matter of public health but also the gender equity. But focusing on women cardiovascular health, we can improve outcome, reduce mortality rates, and contribute to healthier society overall. There are the different diseases like hemorrhagic heart disease, valvular heart disease, aortic and heart arrhythmia. Now I'm going to talk about the global perspective of gender disability. The global perspective on women's cardiovascular health focus on understanding and addressing the disabilities in heart disease outcomes between men and women across different countries. Cardiovascular disease is the leading cause of death globally, yet research and healthcare system have historically centered on men, leading to gap in understand and treating CVD in women. Now I'm going to invite Mr. Abdul Rafe, my other group member, for further group presentation.
My name is Abdul Rafay. Now I'm going to present the global perspective and gender disparities and cardiovascular health. Underrepresentative of women in clinical trials and women with system and misdiagnosis and delays treatment. The next point is the Global Health Initiative and the gender sensitive research by WHO's and Global Health Alliance. And the second point is psychology, economics and culture factors, less access and women to health and economic and is faced by a woman. And the other point is effect to close the gap, increase advances the gender, specific research and awareness campaigns, global health organized and working to raise awareness, working on policies that ensure the equipment and access of the healthcare service by women, the gender disparities and development countries. In countries like United States and the UK, there has a punished of the include and the women clinical trials. In like India and Pakistan, cultural barriers are limited healthcare. And the next is the Pakistan perspective, culture and social factors, uh, lacks of knowledge and education about the CVD in the women and rural area, taboo of openly discussion of the women systematic, and the economical factors like financial sources, barriers in the healthcare. The healthcare system challenges and the resources of health and system. Uh, gender barriers and because of the concept of the beginning of male diseases, lack of gender specific health policies, and the next point is public health initial and government response. Basically limited healthcare campaigns of the government initial for the healthcare improvement and the under considerations. Basically, they are the major decision-making techniques of the solid foundation and making recommendation and justification and systematic identification of key factors, allowing to make decision according to the evidence, risk analysis, identify the potential risk, and the evaluation of the policies and programming of our gap reductions. The next slide is SWOT analysis. The basically SWOT analysis is the international and local awareness of gender specific health issues can focus on the woman CVT and the healthcare facilities urban areas can be lower and the government program national health vision of 2016 to 2025 can provide a policy framework and the limited access of healthcare care due to social economic barriers, culture, and normally is a lack of education and lack of misguide of the CVT system and the international funding and technical support for organization, ability of mobile healthcare and research and rural areas and remote areas and the culture of under misguides the effect of the restorative movement health economical challenge poverty is limited the government funds the next slide is the data analysis. The basic purpose of the data analysis is the process of aim to interpret the data, collect the questionnaires to understand the cardiovascular diseases gap between the man and the woman in Pakistan. The analysis will help identify the key contribution to the dispute and the suggested action invitations. And next slide is there basically the tools of the types of analysis. SPSSC use the tools of create the presentation of today and describe the strategy course and test of emotionally and creation and the variables dependent variables awareness of CVD and frequency of healthcare visit cardiovascular health barriers and certification with the healthcare and services and the independent various age education income employment status status and health history. The next slide is my result. Expected outcomes analysis will reveal the key of demography and social economy and effective the contribution to the CVD gap between women and men. Insight from the analysis will guide the development of target intervention to reduce the disparity in cardio versus health. The awareness is the female is the means of the 1.8932 and the man is the means of the 2.000. And now I am invited to the next group member is Ali Hassan.
Hello, my name is HUSNAIN and I am going to resume our presentation. Now I am going to tell you about knowledge and awareness of cardiovascular diseases symptoms. It means F1.833 and M2.00. Participants male and female have moderate and knowledge of cardiovascular diseases symptoms of scale low 5% and high 2%. Awareness of CVD as a leading cause of death, mean F2.0 and M1.9. Low awareness of male and female dead cardiovascular diseases is leading cause of death in women in Pakistan. Recognition of risk factors, mean 2.99, female have 2.99 and male have 3.00. Participants identified 3 to 4 risk factors, including smoking, high blood pressure, obesity, and diabetes. And also, I'm also going to start satisfaction of cardiovascular statistics. How satisfied are you with the healthcare service available for women in your area? And valid and statistics with healthcare mean female and male 1.49. The average satisfaction score is approximately 1.5 on a scale of 1.2, indicating that most participants are very dissatisfied, 1 to dissatisfied 2, with the healthcare service available for women. And also behavior related to cardiovascular health. Tobacco use mean female have 3.9 and male have 1.9. Most female participants do not use tobacco products at all, while male smoking scale like 1 always 5 equal to never. Fruit and vegetable consumption mean female have 3.500 and male have 3.5 ml. And also participants consume fruits and vegetables frequently, scale 1 equal to never, and male have 5 equal to often. Physical activity mean female have 2.500 and male have 2.49. Participants engage in physical activity sometimes, scale 1 equal to never, scale 5 is equal to always. And also frequency of visit for checkup. Statistics. How often do you visit a healthcare provider for a regular checkups? And valid missing and in female have 1.6602 and male have 3.6373. And also cross tabulation knowledge about CVD diseases. CVD diseases, how knowledge are you about the symptoms of cardiovascular diseases? Not all knowledgeable, slightly knowledgeable, somewhat knowledgeable. Not at all knowledgeable have 12.9% and slightly knowledgeable have 74.3% and somewhat knowledgeable have 12% 9%, 9 point. And also awareness have, are you aware that cardiovascular diseases is a leading cause of death among women in Pakistan? Reasons of not seeking medical attention. What is your gender? What prevents you from seeking healthcare? Cardiovascular issues. Select that, apply cross tabulation. Frequency of visits to healthcare. What is your gender? How often do you visit? a healthcare provider for a regular checkups, cross-pollations. Independent sample test. Independent sample test have different sample test. Level test for equality of variations, test for quality of significations. And also ANOVA. How often do you visit a healthcare provider for a regular checkup between groups within groups? Total. Some are squares, some are square for male, some are square for female. And also ANOVA size. And also I am going to represent a summary of key finding. But my I will call to my another friend Karanbir Singh. He will represent and continue with.
Okay. My name is Karanbir Singh, and I'm going to present a summary of key finding. And the first point is women in Pakistan generally have a lower awareness comparatively to men of a cardiovascular diseases, CVD symptom and risk of a factor compared to men. Culture and financial concentrate limiter their access healthcare and facilities. And the third point is a rural area have a limited healthcare infrastructure, making in a different for a woman assess preventive care and treatment to cardiovascular diseases. Is discussion the finding of reveal notable notable gender disparate of a cardiovascular health behavior and awareness in a Pakistan. Men are more aware to than women comparative. Women have awareness of CVD being fatal. Still, they have facing a barrier and a obstacle in a seeking medical help because of culture norms, financial concentrate or limited healthcare service concentrate specific to women. Global business are healthcare trades. It have a 6 point like first of all our global healthcare trends, technology achievements in a healthcare, AI and valuable technology, health equality of disparity in a global healthcare, value-based healthcare models, global business trend, corporate social responsibility, CS, women health, te- te- tel- telemedicine of virtual care, overcoming gender barriers. CVD policies and practice in Pakistan. Policy impact gender specific health strategies. Global policy alignment Pakistan's national healthcare policy. And the second point is a public health programs and practices awareness and prevention. Awareness campaign, community engagement, and practical inventions. Health and third point is a healthcare assess and delivery gender disparities in practice. It have a 3 points as a barrier to access healthcare infrastructure and telemedical as a solution. And the fourth point is a economic impact of gender sensitive investment in healthcare. And it have a 2 point. First of all, global business trends and economics burn of CVD on women. CVD policies and practice in Pakistan. Research and data collection informing policy with gender-specific data, and it have a 2 point. First of all, gap in a data collection and implication of your study, and the second point is global health partnership, leveraging international resources, and it have a 1 point is a leveraging global health initiatives. And theory application, it have in a theory application it have a 4 points, and the first of all is a system theory, and concept theory is a stakeholder theory and complex theory, and another is a balance card BSc in healthcare delivery. And it in this point we have a 4 points like a financial perspective, patient perspective, internal processes perspective, and learner perspective, and learn management in a healthcare. Identifying waste use value of stream mapping to a documents the flow of CVD patients through the healthcare system, identifying delay, displetion, or unnecessary steps, improving efficiency. Implement of a 5S methods of organize and optimize clinical workflow. And the last point, to encourage a smell of increasement, mental of change of process, the focus on a trait of CVD. And my next topic will elaborate my friend.
Hello, my name is Mohammed Riaz, and now I'm going to explain the further presentation in this topic. Now, innovative strategy to address health disparity. The targeted awareness campaign, targeted messaging used to mobile technology, community health workers, gender sensitive healthcare influence, that is the separate and the safe facility for women focused health center, financial assessment program. In this subsidies healthcare services, microfinance innovatives. And now I'm going to explain what is the role of WHO. That is the training program for healthcare providers, capacity building for public, campaign policy, advocacy, and etc. And the another thing is importance of closing and cardiovascular health gap in Pakistan. The first thing is improving women's health and well-being, contributing to the economy of the nation, advancing gender equality, public health gains. And the recommendations are launch public health campaign on social media, TV, radio, providing awareness about CVD, supporting policies that provide fee and subsidized healthcare for women, and target healthcare education program at entire family. And the potential challenges are cultural norms and gender role may prevent women from seeking healthcare, capacity building for public health campaigns, the partnership with NGOs and governments. And the another thing is evaluating the impact of intervention. And the conclusions is to collect data, confirm that existence of gender despairing among women in CVD, women and disproportionately affect by poor management and delayed treatment. In order to address this difference, particular public health program that emphasizes education, raising awareness for women health disease, granting access to the gender-specific healthcare services and needed. And the bibliographies, this Ahmad Sohaib in 2017, gender despairing in health and healthcare utilization in Pakistan, evidence from the Pakistan Social and Living Standard Measurement Survey, and the further report in this link. And the report provides detailed analysis of the challenges and services of the health system of Pakistan, the importance of issue being discussed by the author, which include the insufficient infrastructure, limited access to the service, and presence of different disease, including CVD. And the further bibliography is the research paper. Uh, Research paper explore the association of the women's emphasizes outcome of the health focus in institute of the society such as community, family, authorities related to religion, state, and institute limit autonomy of the woman, thus impacting the access of health, compatibility of making decision about the health.